In this video, I'm going to talk about something that is almost universally considered to be safe, and yet it's not. It's very dangerous. And we have the science to prove it. But I'm going to start by asking a question. What is the worst kind of danger? It's the kind of danger that is unrecognized. Let's say you're standing on the railroad track. Let's say you're wearing headphones, listening to loud music, looking in the opposite direction. You're not aware that a train is coming. You're in serious danger. But let's say you can hear the train, you can see the train. Okay, you're pretty safe because all you have to do is step off the track. I'm talking about calcium supplements. The problem is that calcium supplements are almost universally believed to be healthy. Doctors recommend it to patients, especially to postmenopausal patients. Health magazines talk about it. It's almost universally believed that you need to take calcium supplements for your bone health, when in reality, the science shows that calcium supplements are going to do little to nothing for bone density. They won't do anything to prevent osteopenia or osteoporosis, and they won't do anything to rectify those conditions. But they can be very dangerous. It was about 2010. I was doing talk radio at the time, and I reported on my radio show research that had been recently published, research done at Johns Hopkins University. In their report, they made the following statement: the best calcium supplement is none. Dr. Aaron Michos, who reported on the research, made this statement: I'm very concerned about the potential for calcium supplements to contribute to heart attacks and heart disease. And in fact, subsequent research has corroborated that. Research published in the Journal of the American Heart Association showed an association between calcium supplements and increased risk of cardiovascular disease. Researchers in Australia observed in women taking calcium supplements a 70% increase in kidney stones, a 100% increase in hospital admissions for gastrointestinal side effects, and a 20 to 40% increase in heart attacks. So calcium supplements are causing heart attacks. Remember, 50% of all heart attacks are fatal. It used to be that heart attacks were the province of men. Rarely did women get heart attacks. Now, over the past 50 years or so, women have crept up and get almost the same, they have almost the same rate of heart attacks as men. I believe that one of the multiple causes of that are the calcium supplements that so many women are taking, in many cases on the recommendation of their doctor. Dr. Michos said that the body can only process about 500 milligrams of calcium at a time, and the standard daily recommendation is 1,200 milligrams. So what about dairy products? Because this is another recommendation that doctors make. And obviously it's going to be pasteurized dairy products. Well, let's make one thing very clear. There's a huge difference between raw milk and pasteurized milk. But researchers at Cornell and Harvard universities found that women who had the highest consumption of calcium from dairy products had substantially more fractures than women who consumed less dairy products. This is a very famous study. It's called the Nurses' Health Study. And it was multifaceted, but one of the facets was testing how women fared consuming dairy products and what it did to their bones. Substantially more fractures.